Today we're going to be talking about perineal care, and with us we have a world-renowned vaginal expert, Dr. Vajay-jay, and she's going to be talking about some of the common discomforts that women have after giving birth and how to rectify these discomforts.
Good afternoon. My name is Dr. Vajay-jay. I'm an expert in perineal care, and we're going to be talking about what to expect in your perineal area after childbirth.
Doctor? Is
Yes.
that really your name?
Yes, I am from India. Okay. So the perineal is the skin under the opening of the vagina that extends all the way down to the anus. After childbirth, it can be swollen, very painful, and you can even experience some tear during childbirth. The doctor can manually cut it, and it's called episiotomy.
Dr. Vajay-jay, I have some questions about how my vagina is going to look after birth.
Okay, I'll give you an answer. Before birth, your vagina might look a little similar to this. After birth, however, it might look similar to that. The reason why your vagina is a little wider after birth is because the vagina goes through a lot of stress as the baby is coming out, so it becomes a little, stretched out, and this is normal. However, there are some things that you can do that can strengthen the muscles of the vagina, and one of the things you can do is Kegel exercises. In order to do Kegel exercises, you want to first identify the right muscles. To identify the right muscles, you want to pretend like you're holding a tampon. And if you're able to do that, that means you have identified the right muscles. So once you have identified the right muscles, these are the 3 easy steps you take to achieve good Kegel exercises. The first thing you want to do is tighten your pelvic floor muscles for 5 seconds and then relax it for 5 seconds. Try working on holding a contraction for about 10 seconds. For 10 seconds and relax it for 10 seconds. Then you want to do this for 5 times in a row for at least 3 times a day.
Dr. Vajay-jay, how soon till I can, get it on?
Oh, okay, well, let's talk about that.
Oh, Dr. Vajay-jay, I have one other question. Can you demonstrate a Kegel exercise?
Sure, no problem. So you can have sex as early as 2 weeks after giving birth, but you want to make sure you wait 4 to 6 weeks to have sex if you have an episiotomy or if you have any kind of discomfort down there. Also, low estrogen level can cause a vagina to become dry after giving birth, and you want to make sure that during sex or before sex you use a lot of lubricants. It is also common for women to lose sensation during sex. You don't feel it, you don't enjoy it, and that can happen for months, but don't worry, that will resolve on its own. On a side note, regular breastfeeding can actually delay ovulation for approximately 6 months, but you don't want to rely on that for birth control. So you want to make sure that you're using other forms of birth control if you have to have sex. Okay, so let's talk about vaginal discharges you will notice after giving birth. This discharge is called lochia. While you're in the hospital, your lochia will be considered what is considered lochia rubra. It is bright red and should only be present on day 1 to 3. Lochia serosa is present on 3 to 10, and it is pink or brown tinged. Lochia alba, however, is white or cream colored discharge, and it should be present for 10 to 14 days. However, it is common for your lochia alba to be present up until the 3rd through the 6th week after childbirth.
Dr. Vajay-jay, what if I'm having abnormally heavy bleeding, like saturating a sanitary pad in an hour, or having blood clots that are bigger than a golf ball?
Call Dr. Vajay-jay right away. So if you've had an episiotomy or vaginal tear during delivery, the wound might hurt a few weeks. Extensive tears might take longer to heal. In the meantime, you can help promote healing by sitting on a pillow or padded ring if sitting is uncomfortable. You can also use dermoplast. This is a pain reliever for the Perineal Care that comes in a spray bottle. You can spray this right on the vagina itself or onto a pad that contains a witch hazel.
Oh, it hurt!
How? Who is this witch?
That's not a witch. That's the witch hazel.
Witch hazel pads can be used to heal the cut or torn skin and also to help reduce the risk of infection. It is sometimes recommended to chill the pads in a refrigerator prior to using them. This allows them to double as a tool to clean and disinfect the wound as well as a cold compress, which can help to ease pain in the area. Also, urinating may be painful. To ease this pain, use a squeeze bottle to pour warm water over your vagina area as you're urinating. Additionally, having a bowel movement may be painful. To ease this discomfort, press a clean pad or washcloth firmly against the wound when you bear down for a bowel movement.
Ooh.
Finally, take pain relievers or stool softeners as recommended by your healthcare provider. So you want to contact your healthcare provider if the pain gets worse, your wound becomes hot, swollen, and painful, or if you notice any pus-like discharges. Call your doctor right away because that may be a sign of infection.
Dr. Vajay-jay, there's one other thing I wanted to ask you about.
What is that?
My cousin's niece's sister's nephew's mother got hemorrhoids. Do you think I'll get hemorrhoids too after having a child?
So hemorrhoids are common during pregnancy and postpartum period. They are blood vessels that have become unusually swollen that show up in the rectal area. Hemorrhoids typically range from the size of a raisin to the size of a grape. They can be itchy or painful, and sometimes they can even cause rectal bleeding, especially during the bowel movement. Sometimes the enlarged veins protrude through the anus. When this happens, you'll feel a soft, swollen mass. Some women get them for the first time while they are pregnant. And if you had them before you conceived, you are likely to get them again. Luckily, they often go away on their own soon after you give birth. Pregnancy makes you more prone to hemorrhoids, as well as to varicose veins in the legs and sometimes even in the vagina. Vulva.
Dr. Vajay-jay, if I do get hemorrhoids, what do I do about that?
So what you want to do is apply an ice pack to the affected area several times a day. Then you want to soak your bottom in a warm water, in a tub, or a sit bath. Try alternating cold and warm treatments. Start with an ice pack followed by a warm sit bath. Well, if you have any problems, you can ask your healthcare provider to recommend a topical anesthetic or medicated suppository.
Thank you, Dr. Vajay-jay. You really